everyone, my name is Stevena Joseph and I'm with SVJ Insurance Advisors. Thank you so much for watching my video. Today I'm going to be talking a little bit about the Medicare Supplement Plan N. If you're not familiar with it, you should get familiar with it, whether you're on a Medicare Supplement Plan now or considering a Medicare Supplement Plan. Definitely look into the Medicare Supplement N because one, the premium is going to be less expensive than a Plan G, which is right now the Cadillac of plans for anyone who is just getting into Medicare after January 1st, 2020. So Plan N is going to be an alternative to Plan G in a number of ways. First, let's talk about how it works when it comes to your hospital coverage. Good news is it covers you the exact same way as Plan G. So with your Medicare Part A, you have a deductible. Your Plan N supplement would completely cover that deductible for you. Right now, if you look at this grid, the deductible is $1,408. The Plan N Medigap plan or Medicare Supplement plan will completely cover that deductible for you. If you're in the hospital for an extended period of time, if you get to 61 days, you'll actually start to have a copay of about $352 per day. The Plan N Medigap or Medicare Supplement plan, either how you'd like to call it, will cover that copay for you. So really, there's no difference in a Plan N versus a Plan G when it comes to hospital coverage. You're definitely going to have the full coverage that you need, be able to see whichever doctor you want to see or be in whatever hospital you want to see that accepts Medicare. So that's great. So we've got how it works with Plan A. Pretty simple. It'll cover the hospital costs, the deductibles and co-pays that Medicare doesn't cover, and you'll be pretty much in good hands. But how does it compare to your outpatient services? With the Medicare Supplement Plan G, you would have no co-pays, right? Well, with the Plan N, you do have copays. In fact, you'll have that deductible first of $198 this year. And it could stay the same for next, but it can change from year to year. So you'll meet that deductible of $198. And then after that point, your Medicare Plan N would kick in and start to help you cover those cover the services that you might need. So if you go to the doctor, you're going to see that pretty much your entire bill, except for up to $20, would be covered. So that means you would have a copay of no more than $20 for a doctor visit. And that $20 copay would be for any doctor that you need to see, whether it's your primary care doctor or your specialist. And again, because you're in a Medicare supplement plan with your Medicare coverage, you can see any doctor you want to. There's no network as long as they accept Medicare patients. So it's pretty awesome. Right off the bat, you have a lower premium, and you have co-pays, but the co-pays are not bad. No more than $20 for a doctor visit. And then when it comes to an emergency room visit, you would have a copay of $50. What's nice is if they admit you into the hospital, I mean, that's not the nice part, but if they admit you into the hospital, you will have the $50 waived. And that's the nice part. So if you go to the emergency room and they send you home, which is ideal, you'll have a copay of $50. That's it, right? But if they keep you, then your copay is completely waived because your hospital benefits kick in. And of course, the Medicare supplement and your Medicare plan together will take care of your hospital cost. Pretty awesome, right? So let's recap. You've got a lower premium with Plan N, and you've got co-pays of no more than $20 for your doctor visits and a copay of $50 for your emergency room, which is waived if you're admitted to the hospital. So what's next? Not bad, right? Pretty good coverage so far for a lower premium plan. The other thing that you should consider when purchasing a Plan N Medigap plan is excess charges. Well, what are excess charges, Stevena? I've never heard of that before. Tell me what it is. It's simple. Sometimes a doctor can charge more than the approved or assigned amount for a service that you're going to get done. For example, you go and you get your knee checked. The approved or assigned amount for that service could be $40, but your doctor is, some specialist, great, wonderful doctor, and he's not accepting that assigned amount. He wants $45. Well, you would be then responsible for that extra $5. So in this case, you'd be looking at, your $20 copay plus an additional $5 to see that awesome doctor that you see. This is not something that you would come across often. Just so you know, very rarely where you find a doctor who takes Medicare and charges more than the assigned amount. And even if they did, it would be no more than 15% over the assigned amount. So it's not that bad. I can just put it that way. It's not that bad because you really wouldn't run into it often. And when you compare the amount of money that you can save by going with a Plan N to potentially finding that, 4% of doctors out there who charges overages, it's very rare. Okay. And if they are a doctor that charges overages, I'm sure they would be worth it. You know what I mean? If you're in a situation like that. So overall, the Plan N is an awesome option. If you'd like to review what the cost for Plan N is in your zip code, whether you are in another Medicare or Medigap plan, Medicare supplement or Medigap plan or not, definitely looking at the Plan N as an option to either switch into or to just get because you have no Medigap plan is something that you should consider because not only are you going to have lower premiums, your co-pays are pretty low compared to, and then also the Plan N seems to stay pretty steady in costs per year. So we don't see the Plan N premium increasing as much as we see Plan G or Plan F plan increases. In fact, I've seen some of these carriers actually lower the cost of Plan N, which, you don't see that often. So definitely give us some thought. Give us a call over here at SVJ Insurance Advisors. I'll be happy to speak with you, or one of my teammates can certainly chat with you, shop those options for you at no cost. Our services are 100% free of charge, and we can see if we can save you some money. Anywhere from $40 to, in some cases, $80 a month in savings by switching from a Plan G to a Plan N, or just getting into a Plan N if you're shopping Medicare supplement plans for the first time. My number is below. Give me a call. I'm happy and here for you, and certainly able to answer any questions you might have. Thank you so much for joining me, and you have an awesome day. Bye-bye.